Blazing Hot 91, we will get through this together, and we are here in Health Healing in Hampton Roads. I have Doug Teddy Bear Perry here as well from Blazing Hot 91 and doing an interview with
Dr. Cynthia Burwell. She is a professor of the Department of Health, Physical Education, and Exercise Science, and serves as the director of the Center of Excellence in Minority Health Disparities here at Norfolk State University. Now, she has worked in the health industry for over 30 years, with 17 of those years, INC being right here at Norfolk State University. She holds a BS degree in Health and Physical Education from Hampton Institute, now HU, and she has a master's degree in Health Education from Penn State University and a doctorate in higher education leadership from George Washington University. Welcome to Health Healing at Hampton Roads, Dr. Burwell.
Good morning.
Good morning. All right, let's talk real quick about disparities here in Hampton Roads as far as health disparities.
Okay, we know that health disparities are those preventable differences that we see amongst populations. And in particular, we're looking at health issues that are at a higher rate in our minority populations. So what we have here in Hampton Roads, we're seeing higher rates of colorectal cancer. We're in the top 3, according to the American Cancer Society, for colorectal cancer in African American men in the city of Portsmouth. We also are ranked number 10 as far as the Susan G. Komen Foundation for breast cancer in African American women. And we also see a disproportionate cases in diabetes and heart disease as well.
Is it a thing of we need to be able to trust our physicians and to be able to go a little bit earlier in life so that, let's say you were talking about colorectal cancer, is it that like African American men need to get screened more, as well as people who have a history already of, let's say, cancer of the breast or cancer in their families, that they look at their family history and be able to talk about it as a family and then go to a physician?
Yes, that is a very important part of how we can reduce health disparities, in that we need to take the initiative to look at our family history, to look at our heredity. What did Grandma have? What did Uncle Joe have? What did, other members in our family, what did they have, and why did they die so early? And look at those things and talk about those things. Yes, a lot of times we don't even talk about these issues in our family.
How do we go about talking about those issues? Because sometimes we just don't want to talk about the issues of our forefathers or our family.
Yes, that's very unfortunate, because when we do that, we don't allow ourselves to get the treatment early on that we need. And something like colorectal cancer, for both men and women, we need to go earlier if we have a family history of colorectal disease in our families. Now the gold standard is age 50. They are reducing that age because we have found that there are younger people who are actually developing the disease, and we want the insurance to be able to pay for that. But unless the gold standard is reduced, the insurance companies are not likely to pay for a young person going in to get a colonoscopy.
Okay, you just said a magic word here, insurance. Mm-hmm. Because this has been something that's been going on for a while, of younger America not really having the insurance that they need to take care of themselves.
That is true. Now, we do know that the Obamacare did allow for our young college students, and actually students or young people under the age of 26 or up until the age of 26 to be able to be on their parents' insurance. That was a benefit of the Affordable Care Act. And so what we need to do, and the state of Virginia has also now, we have the Medicaid expansion, and so we have access that with the Biden administration, we have now the open enrollment for the Obamacare, and so if young people, who need to get the insurance, they need to do some exploration in what is being offered. Yes, you do. Some of the people, because of their economic status, may not have to pay that much for that insurance, but they still need to go and investigate to find out what is available to them.
We're talking with Dr. Cynthia Burwell. She is the professor in the Department of Health and Physical Education and Exercise Science here at Norfolk State University. She also serves as the director of the Center of Excellence in Minority Health Disparities here at Norfolk State University. Now, Dr. Burwell, let's talk about real quick COVID-19, because we have now a pandemic that is going on now, and we have to talk about the vaccinations and the community not trusting the vaccination and being able to get the vaccination into as many arms as possible. Let's talk about that in a few moments.
Okay. The COVID-19 pandemic did really highlight health disparities, particularly in minorities. It brought out the fact that those people who were contracting COVID-19 had underlying issues such as hypertension, diabetes, obesity. All of those were issues that they found were in those patients who contracted COVID-19. They didn't have every one of those issues, but some of these issues were found in those patients. Now, one of the things when it comes to the vaccine, there seems to be some hesitancy amongst minorities. We do see that our older members of our community are getting the vaccine now, and I think a lot of it has to do with accessibility and availability.
Just this morning as I was coming in, I was hearing that they wanted to start now vaccinating people who were younger and putting the vaccine into younger people's arms now.
Yes, that is true. The first round of vaccine went to our healthcare workers, followed by our elderly members of the community, and now they are opening it up so that younger people who may have comorbidity or other underlying conditions can get the vaccine, and then eventually we're going to see it open up to all of the population. I would say those that are 18 and older, and even some younger teens will probably be able to get the vaccine as well. But I believe that the availability or the opportunity to get the vaccine is going to increase the numbers that we will see of people getting the vaccine for COVID-19.
Okay, and my final question to you on Health Healing in Hampton Roads for this Wednesday is, how are you making a difference in the community?
What we're doing with the center, we are continuing to work with our faith-based community. We work with our health ministry leaders in the churches to provide them with evidence-based education so that they then can take that information to their congregants. We also are working to help our faculty on the campus. Those that are interested in health disparities, we're providing them with funding to start small research projects so that they then can take that information and go for larger funding, go to a larger funding agency to get another grant to continue the work in health disparities. So we want our faculty to be primed to be able to do work in this area as well.
Thank you so much for coming on Health Healing in Hampton Roads. How can the 757 get in contact with you?
They can contact me. My number is 757-823-9494.
INC, you see, the community is definitely supporting everything that is going on so that we can become a better person in health healing in Hampton Roads.
Absolutely, absolutely. And we thank you, Dr. Burwell, for coming on. I can't say enough great things about it.
Thank you so much for inviting me. I really appreciate you doing this.
All right. And I hope you have a great day. And I wish you great health. And I wish you to give great health to all of us. You know,
yes.
we're looking
Thank you
towards
so
you.
much.
All right. Have a great one. Everyone out there, we'll get back to the music. And we still got a few things coming up. Just stick around with Blazing Hot 91. We'll get through this together.